This is a lung ultrasound. This lung ultrasound has been obtained with a butterfly machine in lung mode. This ultrasound contains B lines. We're going to talk about the ultrasound. Here we can see the skin and subcutaneous tissue, and then we can see the pleura. Also, there are some A lines. Now, note from the pleura some vertical artifacts or lines that appear and disappear and come back and forth, erasing the A lines. These are called B lines. It is normal to observe up to 2 B lines in a scanning area or a quadrant. More than 2 B lines might be abnormal. Then we can see a rib and another rib, and they're accompanying acoustic shadowing. So the structures we are seeing are the skin and soft tissue. Then we see the pleura moving. We see the A lines. We see the ribs and acoustic shadowing. And then we see an artifact that looks like a line. These artifacts are called comet tails, and in the lung are called B lines. They are usually associated to pulmonary edema. However, they can be seen in other conditions. Here we see a lung ultrasound obtained with a curvilineal array probe. Again, we see the skin and subcutaneous tissue. We see the pleura coming back and forth because of the respiration of the patient. Then we see the B lines. You can observe the vertical lines that are coming from the pleura back and forth. And in this case, we do not see A lines. So the B lines have erased all the A lines. This is an abnormal lung ultrasound. Other structures that we can see are the ribs, and we can see their acoustic shadowing. Again, B lines, like A lines, are only artifacts and do not represent a structure. B lines. B lines are vertical. They come from the pleura or originate in the pleura. They are dynamic, so they can appear and disappear and move back and forth with the pleura. They erase the A lines when they appear, and they are projected through the whole ultrasound field. You can see that the whole ultrasound field is full of the B line. In this case, we see a patient that is in respiratory distress. You can see the pleura moving back and forth very fast. And that is because the patient was significantly tachypnic. The patient has innumerable B lines, and now the lung looks white. When we encounter so many B lines, we can call this a white lung.